Hello, hello, and welcome everyone. Today is Wednesday, September 8th. It's 9 a.m. here on the West Coast. And then my guest, who I'll be introducing in a second, oh, you're that way to my screen. Robin Stern is in New York, so she's repping the East Coast. So it is noon out there. So welcome everyone. Thank you so much for joining this live. It is another episode of Chris's Corner. Super excited about it. So we're going to be talking today a lot about back to school. So obviously right now, most people are either going back to high school, middle school, college, and you or a child or a loved one maybe, or a client, because we have a lot of therapists that come on as well. You guys are absolutely dealing with some different struggles when going back to school. So the IOCDF has created digital and virtual programming around that. And today we're going to be focusing on BDD and body image going back to school. And then a huge also discussion that we're going to be bringing up is social media, traditional media, and the messages that sends. So we're so happy to have everybody here. As always, please make yourself welcome and known in the comments. Say hi, shout out to us, tell us where you're from, where you're watching from. I know we have a lot of people from all over the country and all over the world that watch. So definitely announce yourself, say hi, introduce yourself. Also, if you have any questions, we definitely want to incorporate questions and comments throughout this discussion. So if there's something that you can relate to and want to comment on that, or if there's any questions that you have for myself or my guest, please go ahead and say something in the comments. Also, I know that obviously the IOCDF represents OCD and related disorders, BDD being one of them. We also want to address body image from a clinical standpoint. So the IOCDF is definitely coming out and wanting to support you with all your body image difficulties. And we also are here to help you with anything else. If you have questions about non-BDD or body image items, we will definitely get to that towards the end of the stream. So go ahead and make yourself known, ask questions, and I'm excited to be here. So before we jump into this live, I always want to remind people that this live stream is absolutely intended to serve as an educational content and is not intended to replace therapy. So for treatment-related questions, please be sure to work with your local provider or contact a local clinician. The IOCDF is not a crisis line and should be not used if you are feeling in distress or unsafe. If you're in a crisis or you are ever feeling suicidal or unsafe, please go to your local emergency room, call 911, or call the suicide prevention hotline at 800-273-8255. Also, the IOCDF is absolutely trying our best to create as safe space as possible. So please be kind and respect everybody's comments. With that, this is being broadcast on various social media platforms and is being recorded. So please be mindful of that. If you ask personal questions or leave comments, at the end of the day, we're all here to support one another. All right, so I have some fun announcements. That's going to come at the end. But before we move forward, I have to introduce the guest that is on the screen with me. So Robin Stern is someone I have known for a good minute, really amazing clinician as well as individual with an OCD and related disorder. I'll let her open up if she'd like. But one of my favorite people to speak at conferences with, connect with. We have a fun little body image group chat going on. So I'm excited to have Robin. So Robin is a licensed clinical social worker, LCSW, and a therapist in Florida, New York, and California, who's been practicing since 2012. She received her master's in social work from California State University, Northridge, and a master's in counseling education from Hunter College. She provides therapy in Florida, New Jersey, New York, and California. She has personally been affected with BDD and anxiety, so she has a unique perspective and approach. She combines research-based treatment and her own successful treatment strategies and tailor them to each individual client. She treats BDD, OCD, BFRBs, and anxiety disorders because she knows that they can be life-changing and painful. However, with the right modality, including cognitive behavioral therapy, exposure response prevention, acceptance commitment therapy, habit reversal training, and mindfulness, she can teach her clients to learn not to engage in compulsions and challenge the way you think and feel, and most importantly, come to experience a healthier and better quality of life. She's professionally trained in CBT, ERP, ACT, DBT, habit reversal training, and trauma-informed therapy practices. So I am super excited to introduce my guest, Robin. Hello, how are you doing today?
Hi, thank you so much, Chris, for having me. Hi, everybody.
Yes.
So grateful to be here today, especially at the beginning of the school year, having such an important conversation about body image, BDD, and all things related to that. Like Chris said, I myself not only am a clinician that treats these disorders, but I've been affected with body dysmorphic disorder probably since my late teens, diagnosed at 22. And so I truly am very passionate about the work that I do and the speaking that I do, because I want to get this message out there so that people can have the best opportunity to live a very full life where, in this case, body image or body dysmorphic disorder is not impacting their functioning to the point where they can't function. So thank you again for having me. I'm really excited to be a part of this conversation.
Absolutely. What I'd like to jump into is obviously, let's talk a little bit about the differences. So we know that body dysmorphic disorder is an OCD related disorder. And we also know that maybe people don't specifically struggle with body dysmorphic disorder, yet they're still struggling with body image. And what I'm always worried about, and one of my kind of missions as one of the IOCDF's lead advocates, is we have a really good and strong BDD special interest group that does a lot of good work. What I'm always nervous about is I'm always seeing on TikTok, speaking of social media, people giving advice on body image that isn't research-based. So I really do, even if somebody doesn't have BDD, want people with body image to come to us, because I feel somebody who treats BDD has a better clinical approach to even body image in general. So maybe to start off, can we talk about the difference about body image, BDD, also, people that are struggling with their body weight, and there's also the term body dysmorphia, there's Zoom dysmorphia. So maybe can you kind of pile through what all of those terms mean? And I'm guessing people who are watching this might relate to something that you described.
Sure. I think, us as clinicians, when we're doing diagnoses, we're looking at impact and quality of life and functioning. So I think that's kind of the baseline that we look at to see, okay, are we dealing with something as severe as body dysmorphic disorder? Are we looking at something more of a body image disorder, or not a disorder per se, just body image? Now, I agree with you that I think someone that has the background in treating BDD would be very effective in working with someone with body image. I think we have to be careful with the things that people are saying online when they're coming from, it's, I think these platforms like TikTok and everything, it's great to have it, but I also get worried when these people are not vetted, giving out like information when people may be struggling. So if we look at we'll start, let's say, with body image, people are maybe not satisfied with how they look. So it could be anything. It could be from, their face. It could be from various features on their face. It could be their body size, but it doesn't necessarily meet diagnostic criteria for, let's say, body dysmorphic disorder or an eating disorder, but it causes some level of distress. And so some people, especially when you're talking about social media and you're talking about all the messages out there, I think we do live in a very appearance-focused world. And so there's a lot of pressure for people to have to look a certain way to feel like they're okay. And, my pet peeve is this whole idea of filtering to the point where it's beyond someone's recognition. And I think people, whether they have body dysmorphic disorder or even body image, they're very susceptible and vulnerable to all of that message being out there, that they're looking at people that actually don't even really exist. It's more of a filtered image. Now, if we're looking at what differentiates the two, with BDD, we know people with body dysmorphic disorder, it really impacts their quality of life and functioning to the point where they don't just not like how they look. The body part of concern causes such distress that they don't want to even go out of their home at times, have difficulty going to school, work, having relationships, social relationships. It impacts like their family life. There's so many components. So I think, when you're looking at dissatisfaction with body image and appearance, we really need to go deeper and see, okay, how is it impacting? And that really, I think, will differentiate, is this just a body image concern in today's world, or is this body dysmorphic disorder? Truly, in terms of treating it, one thing that I say universally to clients is we want to live a life regardless of how you feel your appearance is, right? So the goal is, can you live life and your appearance not be the focus? So we have to, especially people for BDD, it's again, people confuse it with a disorder of vanity. It's not. It's such a debilitating condition where one feels that they're so defective because of what they perceive themselves. It's a disorder of perception of their physical appearance. And so what I work on, and this is really important, I think, for anybody with body image, is can you make a life who you are, and you are more than just your physical appearance. So you could be a daughter, a son, a brother, a sister, a best friend, you could be a student, someone who has a career. What else defines you? So I think that's important, even with people with body image. You are more than your appearance. And I think in today's world, we really need to drive that message home, because social media and all the filtering and all the photoshopping is giving such an unrealistic expectation of what people should or should look like. And so I think it doesn't only affect people with BDD. It really does affect people all across the board. But I think we do need to, when people say there's body image issues, I think, us as clinicians like yourself that treat it, we go deeper to figure out how, debilitating this condition is. And then that kind of differentiates, is this dealing with body dysmorphic disorder? Is this just a body image issue? Now, body dysmorphia, that word annoys me like no end, because it's not a word. And I think it's a very watered down version of what BDD is. And people like myself who struggle with body dysmorphic disorder, I mean, I consider myself in recovery, but when I did, that word feels very minimizing. They make it sound like everybody has it. And I just would really caution that, because I don't think everybody like myself, I had multiple medical leaves. I wasn't able to leave my house at times for a month at a time. I don't think people who have normal body image issues get stuck like that. And so I think the word dysmorphia, that you hear people go, well, doesn't everybody have body dysmorphia? No. And it's not a word. I think it's a media coined term that, while it's given us attention to what the true definition is, I think it's a little bit dangerous, because it's not, I think people that I've seen that come into my practice that use that term, aren't even sure where they fall into that category, because they're really suffering from extreme distress. And then all of a sudden they're like, but everyone says they have body dysmorphia. So maybe they don't even think they have body dysmorphic disorder. So while it's great that the message is getting out there and the word is already out there, I think body dysmorphia is more closely related with body image concerns versus the true diagnosis of body dysmorphia. Now, with dysmorphic disorder. Now, in terms of Zoom dysmorphia, I think, again, it's kind of like an offshoot of body dysmorphia. It's just the sense of you see yourself differently in Zoom as you would, let's say, in real life. Again, you know this very well, that people with BDD, it goes beyond just seeing themselves. It affects the core of who they are. They can't function. I can't stress that enough. It's not just I don't like how I look. I wish it was that easy. I wish my struggle was that easy. That wasn't what it is. I couldn't leave my home. I couldn't do things with family. I didn't think I was worthy enough to be in a relationship. I didn't think people would want to even associate with me. I thought it was going to it did affect every facet of my life until I got treatment. So once again, this idea of Zoom dysmorphia, I just think it's you don't like how you look, but it doesn't hit all the core points that something like the severe disorder of body dysmorphic disorder. So all these things are very crucial. And obviously, with being online more and still the pandemic being something, and we're still transitioning to both in-person and online stuff, all these topics are very important. But I think the take-home message is that the true disorder of body dysmorphic disorder is definitely different than body image, is definitely different from Zoom dysmorphia and body dysmorphia. And that, in terms of kind of treating it or looking at it, the goal overall is to be more than just your appearance and to not let your appearance dictate your functioning. Now, someone with BDD goes further than that, because we know that you can't see yourself clearly. And that's just an acceptance piece that people with BDD, I think there's not enough research with body image issues. Do they have, we know with BDD, people's brains light up differently and their visual processing is differently. I don't know if we have the research out there with body image to say the same thing. So, there's definitely things like that, where we have to talk to clients about, look, you may never see yourself accurately. Can you accept that? Can you realize that if you begin to accept that you can have a better quality of life? So I hope that wasn't too long-winded.
But no, I'm glad that you addressed it. What I like to explain, because I'll have a lot of clients come in and I want us to jump into the conversation about going back to school. And I have a lot of clients that have felt more comfortable not being in school because they do have BDD. Some of the clients I work with may have OCD as well as some body image, or they have an eating disorder, et cetera. And, one of the things is I like to explain what they're going through, because BDD, like you said, just like OCD, I mean, this is a chronic chronic disorder that someone's going to live with for the rest of their life. Now, I know that sometimes can be daunting, but I always remind people that with good treatment, whether it's the behavioral component, medication, or both, always at least have the behavioral component, but at least if you're adding medication, you can live a fulfilled life and you can minimize it and you can be in recovery and in management and really handle it. I like the point that you made. I believe that the reason sometimes people feel minimized when they have BDD, for instance, or if they have really extreme body image issues, maybe they don't have BDD, but they've struggled with their weight their whole life. They've gotten, harassed by family and parents and comments made their whole life, or, maybe they've gotten like a scar in their face when they're young or a birthmark and they really hate how they look, or they're embarrassed about a weight gain, or, they never were able to get braces and they're embarrassed about their teeth. Like, it causes a lot of distress for people to where they're avoiding certain activities. They're not showing up to locations. They're not going on dates. They're not going on dating apps. And then when they go online, especially on social media, and people are posting on, I see on TikTok all the time, there'll be like a guy working out and he's like, gym bros tell me I look good. And then it cuts to him in the mirror, but dealing with body dysmorphia. And it's like, feeling that you don't look good that day from the gym or something is not the same as somebody who hasn't dated for years or things like that. So I think that's why it's always important to kind of differentiate. And I don't want to diminish, like, if you're dealing with body image issues, that's part of our discussion today. Like, we want to support you as well. I just know that a lot of people feel minimized.
Absolutely.
I wanted to jump into, well, first I want to say hi to some of the guests that say hi. Alexandra, who's a great person. Really, really good to see you. Dennis, we always love Dennis. Thank you so much. We love you, your wife, your daughter. Thank you so much for everything you do for our community, as well as Phyllis Duarte. Love Phyllis. Thank you for our BDD folk coming out and support. Let's jump into, there's a great question by Alexandra, and I'm going to jump into that in a second. But I wanted to ask you, going to school right now, that's kind of the theme for the month for our live streams. There's some people going back to school virtually, depending on where they live. And I know a lot of clients that are struggling with body image hate seeing themselves all day, because as we work with clients, we're teaching them, use the mirror when you need to. You're brushing your hair in the morning, etc. Don't stare at yourself all day, yet they have to. And even if people aren't virtual, they're going back in person, and now you're seeing other kids, and comparison is a big problem. So what are some of the things people should be looking out for as they return back to school, college, middle school, high school, etc.? And what are some of the things that family members can do to support, or what are some of the things people can do to prevent body image from getting worse as they return back to school?
So I think initially is this acceptance piece of that there is going to be a transition, right? So it's like, instead of, I always do, it's like the coping ahead. So it would be unrealistic at this point, we're still in the pandemic, but transitioning back, it's for everyone universally, it's going to be a hard time. And so people with body image concerns, if let's say they've been out of school for a year and a half, their initial thing is coming back. What I hear a lot is people are going to notice things they didn't notice before. People are going to be more aware of these, physical defects that I seem to have. And so it's, again, what I would say is, being aware that there's going to be an initial transition period, and there may be some uptick in anxiety associated with that. But it's like all about what tools do you come in with? So realizing, whether we're dealing with a body image concern or BDD, we're dealing with a distortion. We're not necessarily dealing with this is a reality, right? So really understanding that, acknowledging how they feel, how they look, but realizing that how they're seeing themselves is often more on a distorted level and it's not accurate. And, the conversations should be about, okay, how are you feeling? How is it impacting you? And I always say in terms of loved ones, because, when we're dealing obviously with BDD, we really shy away from any reassurance behavior, right? And even with body image, we're not trying to reassure because we're not trying to reaffirm that appearance is everything. So I would say from like a family perspective is always just being loving and supportive of what's going on and just showing like, I'm here for you. I know that you're nervous going back to school. I know that it's a hard time. Everyone's having a hard time. I love you. I'm here to support you. Let's talk about things. So definitely an open conversation about it. But I would steer clear of you look great and this is, you look fine. Everyone's going to be, I would, just from a clinician standpoint, that's not ideal, but I would say supportive that you're there, that you're having open conversations. again, kind of normalizing that everyone, whether we're dealing with a body image issue or not, going back to school post COVID, being remote for so long, is going to cause some distress, in person. And that's okay. And we're still, most schools are masked. So that's also going to cause, some discomfort. Now, some people, we go the extremes, right, with people with masks. So some people are thrilled to be wearing a mask if they have body image issues. And some people go to the other extreme and are like, oh my gosh, I'm going to break out. My skin's going to be awful. I can't wear this. So we have to really, it's about understanding it, normalizing that, being there, but really, like I said, not, looking at the reassurance seeking, and then always, reminding that, the goal is to be present, to enjoy being around your classmates, to being around people, and that just like anything else, when we're doing our hierarchy of exposures, you're going to habituate. It's going to take a little bit of time. Initially, you might be anxious going to school, but as you get used to it, it will become less anxiety provoking. Now, obviously, for people that are struggling, this would be the opportunity to determine, okay, are you in treatment? Are you not in treatment? Do you need a therapist to support you or not? And that, I think, hopefully the schools are doing a better job of really having an open, forum of support for mental health, even if it's not just specifically body image. But at this point, the last, almost year and a half has been very traumatic for people. And so I'm hoping that the mental health components in the schools are stepping up to be as a support. But I think, definitely the supportive family, realizing there's going to be a transition period, normalizing that, and, pulling back a little bit of, that the image is everything. And I think, what's probably hard too is that, when you're on remote, some people, again, especially people with body image concerns or BDD, they think they look so different online. So they might come into, oh my gosh, I'm going to look so different in person. People aren't going to recognize me. And so really kind of going through that and understanding their concern, but bringing it back to, that's a distortion. That's a cognitive error. That's probably not more of the reality. So I think all of that can be helpful, and it's a hard time for everybody. It is. It's not an easy time. So I wouldn't say it's nice, but what universally everyone is feeling the same thing. So it's about normalizing that experience and having that open conversation and not feeling alone in it.
Yeah, I know when I would return to school, especially in high school when my BDD was really bad with skin, that was a big fear of mine. I'm going back to school. How did my skin look compared to last year to this year? I also had a really obsession with being tan. I'm Greek, so I tan really well, and I was so always obsessed. So before I had to tan. And then, what I'm hearing from a lot of clients right now is, they haven't been able to be as active during the pandemic as they once were. And so I have clients going back to college that have gained some weight and are really uncomfortable about their bodies. And the same thing you just said is, people are going to judge my body. They're going to judge my weight. They're going to judge my appearance. And it's all kind of ties down to, when we're talking about image, there's such this hyper focus on appearance. And that's, I think, the real difference of how do you know it's time to get some help? Yes, there's people out there that have gained weight over the pandemic, or there's people whose skin has broken out because of the masking, or there's people that through the stress of the pandemic have lost some hair. I mean, there's all these different ways that your image may have been affected any period of your life, and, people aging, et cetera. The difference is, are you still able to live and to function? And, there's people without any kind of body image concerns, body dysmorphic disorder, where they are able to, their body's changing and they're sad about it, but they're able to function. Whereas what we hear in our community is just this struggle to even bounce back. I have clients that are like, I'm not going to college until I can get back to how I looked in 2019. But when it's distorted, like you said, there's such a difficulty to to figure out ever to get there. There's always this kind of chase, and the finish line keeps moving. What I wanted to throw in at 9:09 a.m., I think it was 12:09 your time, from Alexandra Reynolds. I think this is a good question on this topic. Is there a standard for a healthy body image? At what point does body image go from simply being normal to disordered?
I think, again, the media and the way society is, I would say probably increasingly over the last 20 years, has focused so much on external appearance, on bettering yourself, but not in necessarily a healthy way. So I think that that's out there for the public. When do I think I think a lot of people struggle with not loving how they look. When does it go from simply being normal? I think again, to disordered, I think when it really impacts functioning. When it gets to the point where it's like, I'm going to avoid doing these things. I'm going to avoid, like, I would avoid going out during the day. I would avoid, if I was going on dates, I wouldn't want to go to a place that has like bright lights. We hear this all the time with people with BDD, you know? So to me, when does it get from normal? I think when it starts to really impact functioning, quality of life, to the point where you have to kind of go to your baseline. Like, what were you doing before? And then now, what are you not doing because of that? And I think, you know, unfortunately, with whether it's social media or just the media in general, there's so much out there that's always about changing your appearance. So again, I think everybody's susceptible to it. But I think, you know, where is it normal? It's like there are people that wake up and like, oh, I don't look that great today, but they go about their day, right? Whereas we know, you know, people with more of an issue are perseverating on it for a very, very long time throughout the day, to the point where they're like, you know what, I'm going to stay home today. I'm not going to go out. I'm not going to go to work. I'm going to call out today. I'm not going to go out with my friends. You know what? I can't even make that commitment to go on that trip. So I think, you know, Alexandra, like, the thing to start to realize is when I think when it becomes normal versus going to more of a disorder is really impacting quality of life and functioning, it's declining. And I think at that point, that's when you really have to take a look, like, maybe I need to do something. Again, would it necessarily meet diagnostic criteria for BDD? Not necessarily, but if you're impacting your functioning, that's definitely something you would want to work with, you know, with a mental health provider, so that you can have a better quality of life and that it's not impacted by your, you know, concern with your body image to the point where you're losing out on living. I say that, you know, people with, whether it's extreme body image concerns or BDD, what they end up doing is they sideline their lives. They're sitting on the sideline of their life. And it's like, it's time to step up and live your life, not on the sidelines. And people often with extreme body image concerns and BDD think, okay, when I look this way, I'll be able to do X, Y, and Z. Yes. And we both know that's never going to happen, because it's such a distorted perception. You'll never see yourself accurately. You'll literally be sidelined and you're not moving forward. So I think, you know, my barometer would be quality of life and level of functioning. And that for each person is going to look different. And again, that doesn't necessarily mean you're going to meet clinical criteria for BDD, but you may want to, at that point, possibly look for a therapist to have a conversation and see where things lie.
Yeah. And the first part of the question about, like, you know, is there a standard for healthy body image? What I remind my clients is there isn't, because you're dealing with body image, body dysmorphic disorder, even, you know, eating or feeding disorder, that does not mean that you don't ever have to take care of yourself. There may be certain things that you want to do to take care of yourself, but there's a difference. So the way that I think of like a healthy body image is, first and foremost, is your body image just one of many things that make you up? So for instance, if your body image is important to you, you know, you like a healthy lifestyle, etc., are you putting that on a pedestal that you're then kind of negating everything else in your life? Or is healthy, you know, working on body image one of many things? You're also working on a degree. You're also working on a relationship you're in. Are you, you know, a pet owner and, you know, raising your pet right is important? Are you a parent? Like, all those different roles. And what I would say, you know, another kind of standard for a healthy body image is making sure that your body image isn't the reason you do or do not do something. So if you're not going to a wedding because you're afraid you're not looking good enough, if you won't meet up with a high school friend because you feel you've aged horribly since you saw them, I mean, that's when it's not a healthy body image. I also constantly talk to my clients about health. So I know for me personally, when I'm working out, when I'm active, when I'm out hiking, when I'm doing all those things, not only do I look better, but I feel better and my mental health is better. So for me, it's more about health. It's about movement. It's about connections, like meeting up with friends to go to the gym together, etc., and less about I have to look a certain way. I don't think the criteria for a healthy body image necessarily needs to be you love your body, because there may be parts of your body you never fall in love with. And that's okay. That body part has a function. It's a reason it's there. And maybe, you know, my goal to work with a client is to get maybe neutral about it, but to find certain parts of your appearance you do like. And I think the other thing I'll add is your conversation with yourself. If you're constantly walking and seeing pictures of yourself and, you know, videos of yourself in mirrors and consistently negatively judging yourself and ripping yourself apart and putting yourself down, that's not a healthy body image. But if you are accepting, if you're loving and you're really like, look, I'm good. sure, maybe I want to dye my hair, or maybe I want to get back into the gym. Great, do those things. But that doesn't make you less of a person until you do that. Just like Robin was saying, I mean, when I was really struggling, I had a list of all the different things that had changed about my appearance. I remember it was like a hairstyle, it was my clear skin, it was, getting in better shape. And I sidelined my life until that happened. And the problem that we always see with this disorder is there is never a finish line and then you're happy. Because we age, because things change, people are never fully ever getting to a point that they just like how they look and they're appreciative. And then what ends up happening is people look at old pictures of themselves and they'll be like, wow, I look so great here. But at the time you hated how you looked. And so it's always one of those things where, people are constantly, hating how they look, looking back, I wish I looked like that. There's never a point that people finally, unless they get treatment, to sit and say, let me be happy about my appearance, let me appreciate it, and let me make sure that I'm doing other things in my life that are important. So thanks for the question, Alexandra. What I wanted to do is shift over to social media, because that's one of the conversations I wanted to have. So obviously, social media is not just something like teens do. I think sometimes when we hear social media, there's also traditional media. There's movies, there's television shows, there's news articles, there's things like that. So what I wanted to kind of check in with you is what is because getting out of social media completely, getting out of traditional media completely isn't going to happen. It's just not something like people could do. People can definitely go on like social media fast, but you're going to be reading a magazine at the dentist office. Somebody's going to be watching a TV show. A person's going to tag you on a Facebook post. How does somebody navigate through traditional media, social media, and not allow that to influence them to a point that they feel inferior, disgusted, and unhappy about their appearance?
So that's I really also talk so much about social media because it's such a hard, line to kind of navigate, because we are in a pandemic still where that's sometimes how we connect, right? So we don't want to socially isolate completely. But it's funny because, I think I learned from you that I set a limit of 30 minutes a day to only be on social media. And when I've exceeded it, I step away from it. So I think it's about knowing, okay, there is some great benefits of connecting with people, but that also it can be a dangerous territory when there's a lot of comparing. And understanding that social media is a lot of what I say smoke and mirrors and not actually real. And so people that are more vulnerable, people that have, let's say, body dysmorphic disorder or extreme body image concerns, they're more vulnerable when they go on these platforms or look at commercials or TV shows or magazines. And so to have that awareness going in, knowing that you're going to be looking at airbrushed and filtered, my thing I just said the other day is that I don't understand that people filter to such a point where they look like avatars and they look like what the word catfish. And obviously I know myself as someone with BDD, that is my biggest fear, is that people won't think I look. So I would never filter to that because that is my biggest fear. But I think actually people that struggle, when they see those images, they think those are real. And they think, okay, this is what I need to attain to be okay. And so I think it's about understanding that the media portrays people to look not necessarily natural. And so it's about understanding that. And that really does impact people who have, body image concerns or BDD. So having this awareness that, to find a balance of a healthy relationship. And sometimes you need to take time off. I took 3 months off online. It was the best 3 months of my life. I was just living my life and not what they would say, posting for the gram or living to post or do. I was just living. I was living and, I'll age myself. I'm 40 years old. So I didn't grow up with social media. So I was able to live very fully. So I'm not saying that people necessarily have to do that, but I think it's about understanding, okay, what are your vulnerabilities? Is it a healthy place for you? Is it not? Do you set limits of what you do? Again, I think if you start to Google things, they start to send you posts for, plastic surgery or posts for, cosmetic stuff. And it's so, and again, so much filtering and so many things that for people with body image concerns, it's a little bit of a dangerous territory. But also understanding it's a way to connect to people. So finding that balance, but really being honest with yourself. How are you feeling when you're going on? Are you feeling okay? Are you feeling worse when you get off of, social media? And it's if you're feeling worse, then you got to ask yourself, is it really worth it? Is it worth it to feel that way? And the biggest thing I just say is that like I said, smoke and mirrors, not real. No one's going on there posting, I'm having a really bad day. Look at this huge pimple on my face. It's like people are posting the most filtered. We see the filters that are out there and the photoshopping. Almost to the point I'm starting to notice it on TV commercials. I didn't even know you could filter that way on TV commercials. So it's, again, because I'm so aware of it, know going in what I'm looking at. I think sometimes people aren't as aware of that, and they need to be, and they really should watch how they're feeling. And if it's making them feel bad, then they maybe need to kind of rethink, is this something that they should be doing? And, now there's just so much with social media. So I think it's a great thing. I think the initial concept of it was great to connect with those people. I think where it's moving in this direction of like constantly filtering and getting likes on pictures, obviously for people with body dysmorphic disorder, bad news all around, not good. Even people with body image, it's really like raising this bar of unrealistic expectations that the people that they're looking at don't even exist either. So I think at least have that awareness when you're looking at the media. Have the awareness that this probably isn't real. And so what you're trying to attain probably isn't either. And then obviously with BDD, it's like you don't see yourself accurate. So it's not even like you're not going to attain it. You can never see what you truly look like. So it's all of that, I think, having that awareness when it comes with social media.
Yeah, and I want to jump back in real quick. I saw your comment about if either of us are taking clients. We'll give our emails at the end, and then that way you can contact us. Lana, I see a great question that I'm going to jump to in a second. I wanted to comment on what you're saying, Robin. What's so difficult is, TikTok right now, I would say, is probably one of the #1 social media apps, especially for my younger clients. And one of the aspects of TikTok, so if anyone's not familiar with the app, it's basically where you can make these, short videos, etc. They have what's called the beauty filter, which is pretty much just like standard on that app. It's not that, like Instagram, people can post a picture or they can put a filter on it where, sometimes people filter it, sometimes not. On TikTok, it's pretty just like automatic. And so, you've had some creators that have shown like, this is what I really look like. And you start to see their acne or the bags under their eyes, but then they put on this filter and they have this lighting and they look amazing. And so you're having so many people kind of being like that shoved down their face, and then comparison. So I wanted to get into that part about social media, and not even just social media, but like when you're, out at school or even not at school, like watching TV or just out in public, how does someone who's struggling with their appearance, not liking how they look, how do they combat comparison? Because that's such a hard part about image, because people are always comparing themselves to social media, all these different places, and it's making them feel inferior.
I know, we can look at what, let's say, people with BDD and then people with body image. When we talk a lot, because that's a cornerstone thing that people with BDD do, like comparing, I always come back to like the thing that they don't see themselves accurately. So when they go out and think they see someone else that looks better, I always say to them, but to caution them that you don't know what you look like. So it's like you don't know if you're at, and then obviously we go back to, you're more than just your appearance, right? So really, especially people with BDD, we know that people with BDD are actually average or above average good looking. Now, that doesn't mean anything, but what we're saying is this is such an extreme distortion of what's really going on. And so, we always try to build outside of the appearance. So one, having the awareness that you're comparing and that you really have no sense of what you look like when you're doing that. And that, again, I always go, how does it make you feel when you're comparing? And they're like, feels awful. So what I always say is, like, when I'm dealing with BDD, I'm like, you go outside and you start seeing yourself compare, you start to say comparison mind. You label that as a BDD behavior. And so you have an awareness, like, this isn't something that I should be doing. Now, in terms of people in general looking at other people, I think it's about, and I know this sounds so cliche, learning to love yourself and learning to accept who you are, flaws and all. No one is perfect. But if you love yourself and you've accepted who you are, then you're not going to be always looking to see how I can be better, what I can look like to be better. You're going to come, and maybe it comes with age, right? So it comes with age of being like, I'm okay. Like, like I'm okay that I have anxiety. I'm okay that I have body dysmorphic disorder. When I was in my 20s, I wanted to run from this. It was taboo for me. This is who I am. I don't let it control me, but this is who I am. And I think that's something, even with body image issues, like, can you accept that you don't feel like you are where you want to be, but that's okay. And oftentimes I would assume even people with body image issues, their perception of their self is often inaccurate too. Obviously not to the point with BDD where they're not functioning or functioning less, but it's most likely a distorted way as well. It's to the extreme that they're seeing it. So again, when you compare, I always ask, is that making you feel better or worse? Sometimes you'll hear clients say, oh, I'm a little bit motivated to do things more to my, but usually not. Usually they come back inside and feel horrible about themselves. So is that effective? And I think, always trying to be the best version of yourself, but not necessarily with regards to appearance. So I'm right there with you, like in terms of exercise, not necessarily for appearance concerns, because mentally you feel amazing. I've been on this kick for like the Peloton treadmill, and it's just like, I have a regular, and it's like a kick. You get a high off of working out, right? And so like a natural high of your endorphins, figure out, comparing is just a trap that's going to be not a good thing, and it's not helpful. Obviously it happens and it's very normal, but have awareness, come back into yourself when you start to do that and be like, is that a great thing that you're doing? Does that help you? Is that going to move you forward in your life? Or are you going to go home and now pick yourself apart? Are you going to go back into the mirror and now want to have, different cosmetic procedures, or go get certain treatments, or go, down like CVS aisle and pick up products? Is that really effective? And again, it's a very fine line because we live in such an appearance focused world. And so this is shoved down our throats. Like, we must look like this to be okay. And it's like, no. When was that standard suggested? It was not correct. And it really is impacting functioning with people.
What I also remind people when it comes to comparison is nobody ever compares down. So what I mean by that is, like, when people are on social media, or let's say somebody goes to a theme park and they're walking around, or the mall, their brain is navigating towards people they find really attractive, or people on social media are following a bunch of models or following a bunch of celebrities that look a certain way. And they're looking at those images and they're disregarding any images of other people, but they're fixating on the people that have appearances that they want, whether it's perfect skin, or, a thin waist, or they're tall, or I love their hair, whatever it may be that you're focusing on. And people are bombarding themselves with those images and comparing to people as they walk around the mall, or they're in public, and then they're comparing themselves down. So it's like, wow, this person looks so great, and here I am down here. Nobody's walking around and saying, oh my God, thank God I don't look like him, or thank God I don't look like them, right? So that's why it's like, comparison is also dangerous, is you're always going to compare, where people are above you and you're lower, and that's going to make you feel inferior. And then we're more susceptible when we have body image concerns and BDD. We're more susceptible to skin treatments. We're more susceptible to plastic surgery and all this. And the problem is, people are chasing those things, getting Botox. People are getting fillers. And once again, I tell people, I don't judge that stuff. The difference is, why are you doing it? Are you doing it in this desperate, I need to be able to do this to function? Is it disordered, etc.? And then people get to that point where, they're doing all these kind of surgeries and chemical treatments and stuff that aren't good for them. You said going down the CVS aisle. I mean, that's really popular on social media, on TikTok and Instagram now too. You're having these dermatologists that have never met with a client, and they're suggesting, go to CVS and pick up these items to get clear skin or to get rid of wrinkles. And then you're having, people buy out those products, and that product may not be good for your skin, but it's just somebody to try to get views. So one thing I wanted you to address is, how does somebody prevent themselves from following social media, certain people on social media, or getting magazines for certain models, or watching shows that have certain actresses that are just bombarding them with these images that they're then feeling inferior around?
So, I'm going to go based on like me, and like how, as someone who is a clinician that treats it, and someone who has BDD, like I stay away from that. That's not how I go into this world. Like, the lens through how I look at this world is, I like to follow people that are motivational. You'll never find me following things on social media like makeup artists, or somebody who, is necessarily a model. Like, I follow people that are like Peloton instructors, like stuff like that I think are healthier for me. Again, so is that going to be more realistic for everybody, that they're not going to follow those things? In an ideal world, if you know that you're really susceptible and vulnerable to following people and then feeling like you need to do all these things, then I would really question whether or not you should be doing that, right? So when I'm working with clients and they're using those social media, platforms to follow, let's say, estheticians or dermatologists, celebrity dermatologists or celebrities, I'll be like, let's take that back. Let's not do that. Let's, not watch those TikTok videos. Let's not go on those pages, because it's not really that helpful and healthy. When we're dealing with this disorder, it's not, again, it's such a, whether it's BDD or even body image, the extent of it is often not as what it really is. And so you're trying to attain something that's not realistic and that you don't even need to attain. And so my recommendation, not to say that, I think you have to know yourself. I think if you're struggling with this stuff, I would say you want to get a better handle on that first before you start like following those people. I don't know. To me, I guess, as someone who has BDD, why would I ever follow someone who's just, their life is about their appearance, or at least that's what they're showing. That's the antithesis of what I need to be doing, right?
Yeah.
So, I'm all about, let's talk about positivity. What are we doing to change things? What are we, that's why I love the IOCF. Like, what are we doing, as a community to make more awareness? To me, there's nothing beneficial to be following someone who's showing me how to have no breakouts. That's not going to be very helpful. Again, what I would say is if you are watching and it's not causing distress, I guess that's fine. But if you start to notice that you're ordering things online or you're being drawn to wanting to get certain treatments, I would take a step back and ask yourself, is this really helpful for me? Is this really healthy? And it's like, my favorite is when people sell, these products, those MLM companies, and they're selling them and they're like, oh, my skin looks great, no filter. And you see a filter on the right-hand side. And I'm like, okay, like so now you're going to buy a product and you're not going to even look, like, it's ridiculous. So, I would say that following those things with people with body image issues probably isn't a great idea. And it's
Agreed. I want to throw in a question from Love Lana at 12:35 your time. The media, social media craze with heavy makeup, like painting, fake eyelashes, not just a little bit of makeup to cover up features or accentuate, but like heavy makeup. Why is it so popular to apply these masks? Why do you think our society is like this? Why do you think, on media, in movies, because if you ever watch a TV show or if you ever watch a movie, there's nobody with acne ever there. Nobody has bags under their eyes. There's filters, there's lighting, there's stuff in movies and magazines and in social media. So what Lana is asking at 12:35 is just, why do you think that there's such this obsession in our culture with it when there's so many people that are negatively impacted by it?
I don't know. I think, maybe even with reality TV, there's just, everything just seems to be so focused on appearance. And again, the last 15 years, I feel like when I was 20, this stuff wasn't even around like this, yet I struggled, right? So I can't even imagine being in the heart of my disorder right now and like having all of this come into play. I don't know why society feels like the way to be okay is to look quote unquote perfect or have no flaws. I think that's actually what makes people unique and beautiful, is to have little imperfections and to look natural and to be okay with them. I don't know why I think in Hollywood, it's like, they always say like women like age out at like 25, and it's like, and so I think it's just this media way and this idea that women, especially women, not saying with men too, but with women, it's like, as they age, it's like men are more defined when they age, but women, they look worse as they get older. And it's like, this is what's out there. And I think it's unfortunate. I don't think it's helpful. I don't know necessarily how to change that, because I think this is what's out there. I think you have some celebrities that are embracing themselves, like, that are not, wearing makeup and are not out there. And then you have people that, are more natural. And then you have people obviously that are very obsessed with vanity, into the sense of like always wanting to get procedures done and stuff like that. I don't know how to change that, other than to say for people, like, really knowing yourself and being like, are you okay with you? Can you be okay with imperfections? And also, again, I would love to see some of these people that are, I don't know. I guess because I lived in Los Angeles and I saw some of these people in real life, they didn't necessarily look like their pictures, right? So I think, you know, you're from California, you've seen that too.
Yes.
So it's like, okay, that's great that they look like this and, you know, on these screens, but then in person, you're like, whoa, like you don't look like that. And yes, you may see people in person that look very good, but that doesn't necessarily take away from your own beauty, your own individuality. And I think that's what matters. It's like, why do we have to look like a certain person to be okay? Why can't we just be okay with who we are? And I think there's so much more joy in life when you begin to accept yourself for who you are, imperfections and all, and be able to be like, I'm okay. I don't need to achieve this to be okay. I don't need to achieve this look to be okay. But it's very hard because it is being thrown down your throat, and it's being in every which way, in the most, you know, just everywhere. I mean, dentist office are now giving Botox. It's like you can't go anywhere without this image of like, you must look okay. And you must look this way to be okay. I think, you know, this is where the conversation of, if you're so vulnerable, like then going to speak to a therapist and going to talk about this. But, you know, hopefully society will start to pull away from that when we've seen things, let's say this pandemic, this has been a real trying time for everyone. So maybe we need to come back to like our grounding points. Like maybe like we shouldn't care so much Botox, fillers, makeup, filters. Like how about like just human connection? How about like enjoying life, like getting out into the world? Let's not worry about getting to the plastic surgery office, right? Let's worry about living life, which we have. So I had hoped that we would see a change in the pandemic after that. Haven't seen any of that yet, but we could always still wish for that.
Yeah, no, you have people like, I know Alicia Keys has been very vocal about not wearing makeup. You have Jamie Lee Curtis who refuses to dye her hair. You had Brad Pitt that said, look, he had them redo a magazine because they had filtered him so much. He's like, I don't look how I did in Thelma and Louise. Like, stop trying to make me look like that. You have Zendaya, you know, the actress who, you know, is like, look, I'm half African American. Like, give me my curves back. Stop editing me down thinner. So it is that, you know, Sna makes a really good point at 12:50 a.m. Eastern time, that surgery is so common now. Even influencers that aren't too famous usually have something done. I mean, that's the other thing that's hard as well, is now you're having all these people come out saying they're natural. You know, oh, I haven't gotten anything done. Oh, just a little bit here. Yeah, even people on Instagram, even these people that aren't like, you know, reality stars, you know, all these reality TV shows now that are coming out on Netflix, Too Hot to Handle, etc. They're all based around appearance, some of the most superficial programming we've ever seen, but some of them have had fillers before going on, etc. And then they try to play it off as natural. So then somebody who's watching that assumes people are just naturally like that. And I wanted to add kind of on the you know, on the male side, I mean, one of the things that I see a lot, you know, I used to run gyms, and there was such a culture about like, once you hit like this 15, 16-year-old age, you're supposed to look like the 25-year-old men in the gym. And I had so many clients that were, I mean, people that visited the gym who were literally taking all these products, you know, creatine or, you know, pre-workout, but then they were taking stuff that were like, oh, it's not a steroid, but it kind of is. And, you know, taking all of that. And then they watch like the Marvel movies, the Captain Americas and stuff. And then you have these actors coming out, and, you know, one of the biggest questions they get is like, how'd you get in shape for this role? Oh, I just worked out with a trainer and I was eating really well, chicken and rice. And there's kind of like a joke that I have with some of my clients. It's like, no, it's not chicken and rice. It's having a trainer basically live with them. It's taking a lot of supplements, some that are on market, some that are off market, that they go on for those movies. There's no way somebody could look like that naturally. So you're getting all these different people doing these things behind the scenes, not being open and upfront about it. And then people, the average person, doesn't have access to all that, and then is feeling inferior, or they haven't gotten or won't get a surgery and feeling inferior. I know a lot of clients right now, they're very self-conscious about their lips, because the big thing is the Kylie Jenners and all that. And they're like, I don't have lips like these people. Yes, because you haven't shoved something in your lips, so you're not. So when we put out all these unrealistic images that the people have to do certain things to get, the average person that can't achieve that then feels less than, and we really got to work on that. But like you said, I think that, you know, doing streams like this is the start, but there has to be this shift where society just gets to a point that it's like, we are not going to base everything on appearance anymore. We're really going to start hiring actors and actresses because they're amazing at their job. We're going to start letting people post become popular because they're great at whatever talent they have versus their looks. So, I think there's been companies like Dove has tried to do stuff and things like that to make the shift. And it's just going to take everybody getting fed up, I think.
Yeah, and I think it's hard, especially with all these filters and it's like people feel like that's the norm, right? It's the norm to filter, it's the norm to look different. It's not the norm to be you. And I think we need to change that again. We think of the last year and a half, human connection, being here in this world when so much has happened. Like, let's go back to the basics. Like, I miss being in my 20s for that reason alone. I love that social media has connected us, but I don't love all the stuff that came out of it. And I think for people going back to school, they probably have a ton of stress after spending months on end looking at social media of what they think they're supposed to look like. And it's just these unrealistic expectation after expectation. And it's such a shame because that's not the answer. That's truly not the answer to being happy and living a fulfilling life. And, I think that's important to understand. Like, again, appearance is one aspect of yourself. It's not what defines you. And people that have issues with body image or BDD need to build more of that sense. People with BDD, it's like even myself, it's like all I saw was my skin. That's it. I was just like, I was a pimple. That's all I was. Like, I was nothing more than that. Like, I wasn't a daughter. I'm not a mother, which I am. All these things. I'm a clinician. I have all these other things that make me up. But when you're focused on either it's BDD or body image, it's like all you see is flaw. You don't see anything else. And I think, again, dangerous territory with all this social media and with needing to look quote unquote perfect or having fillers or no imperfections. It's setting the wrong message. Like, this is what you need to be okay. And it's like, no, be yourself. And I just hope that, with these talks that we continue to push that message out there, and that more messages like this are pushed out there versus let's go get Botox and let's go get filler and let's, get this done and, in this cream. Because like I said, 9 times out of 10, those people that are pushing those products don't look anything like that in person. And so you're literally looking at a facade. You're not looking at a real thing. And people are very susceptible to it. And so it's having that awareness too, and realizing that even the people that are looking this way, they don't even look like that in person, right? So when we did a presentation, I did a picture of Tyra Banks with makeup and without. And it was like, wow, like two totally beautiful before, beautiful after, but it was like you're looking at something that doesn't really exist. And that's really important to realize that.
Yeah, I always do that with my clients, show them different like before and afters of videos and pictures and stuff, and you'd be shocked. We only have a couple of minutes, so I'm going to give you the last word. I'm going to answer Wee's question, then I want you to kind of just give them like a minute or two, kind of like final thoughts. But you ask about, do you see progress in people who have BDD influence surgery that went wrong or they were unhappy with it afterwards? What I wanted to say quickly with that is what I see, what the research shows. There's a lot of really good research on it in The Broken Mirror by Catherine Phillips. And then what I see in clinical practice is the problem is when somebody goes in to get plastic surgery when they have BDD, because they have a distortion, they go in there and they ask for surgery and they push for it. But the problem is because it's a distortion and not really the image isn't really a problem in the first place. I have had almost all of my clients that have ever gotten plastic surgery regret it. And they actually, most of the time I see them post-surgery. I didn't know them, I didn't work with them before surgery, but they come in after a surgery. They either feel like it wasn't done correctly or the doctor didn't go far enough or they went too far or it's imperfect, or worst case, if they do like it, then now their brain is like, well, I liked fixing my nose. What about my cheekbones? What about my jaw? And then they, I worked with somebody who is, they were like early 20s and had already had 6 plastic surgeries before working with me because they couldn't stop because of that. So what I always say to a client is my goal is to get them to understand that they don't need that surgery. However, if they are dead set on it, I ask them to at least work with me for 3 to 6 months because I want to get the BDD out of the conversation. And then even if they do decide to get the surgery, even though obviously I'm not going to put my stamp of approval, they'll at least go in there with a much more clear mind. And so, I haven't had a lot of clients then go through with the surgery, but but the few that have go in and get a much more minor surgery, or they'll not get surgery at all. They might do like fillers or something like that. So I don't ever recommend plastic surgery. It always seems to be a disaster. I know in my own case, thank goodness I grew up poor because I couldn't afford plastic surgery, because I would have gotten it on all the things that I wanted to fix. And I'm glad I never did, because now being on the other side of it and being clear-headed, I realize now that I don't need it. And Phyllis gave you some great advice in the chat as well. Robin, I'm going to give you a minute or two to give us kind of like your final thoughts before we give them our contact information, and then say goodbye, sadly.
So I just want to, wish everyone a happy fall and going back to school, and realize that universally everyone's struggling right now. And, it's great to have this conversation with body image and BDD, and just remember to be open. If anyone's struggling with this, and it's really impacting your life, please reach out to someone, reach out to a mental health professional, reach out to family. You don't have to struggle alone. There is so much amazing resources. I think TikTok's great, but they're not therapists, social media, not therapists. They're not, mental health professionals. Really my goal, in speaking is just realizing that body image BDD does not need to define you. I know how debilitating it is and how one suffers from it, but you truly can live a life worth living where you're not defined by your appearance. I know it feels completely unheard of, but I never thought 15 years ago I would be sitting here speaking here about this. I was so ashamed of everything that I was going through. And I just want to say that might not be your mission and how you recover, or deal with your body image concerns, but you can live fully. And I just hope that you understand this conversation, that you are more than just what you physically look like. Oftentimes you're harder on yourself than what you see in that mirror. Treat yourself kind, be kind to yourself, live a life worth living. Don't sideline yourself anymore. Stay off of social media so you can actually live your life, enjoy life, be in the moment, be present. Thank you so much for having me. And, always a pleasure, talking about BDD and body image.
Absolutely. I want to thank, everybody in the comments was giving us really good feedback. And Anita, thank you so much. Sna, I put my email in the chat. I know you wanted to reach out to us, so you can definitely email me. I wanted to say, and it's up there on the screen, so we could reach out, or anybody, if you have any questions, you could reach out, or anything else that you want to see on Chris's Corner about this topic. But Robin, how can they get in contact with you
if
they want to reach out?
In my email. Okay.
What's the best way? So I know you practice.
Yes. So you could email me at bddresources@gmail.com. And I treat clients remotely in New York, New Jersey, Florida, and California.
Perfect. Well, we also have to shout out, obviously, the BDD Special Interest Group through the IOCDF. I know we have a meeting coming up, and we're always doing great work in the community. Don't forget the IOCDF has a BDD-specific website. So if you go to the iocdf.org website and you click on BDD, it'll actually take you to a website, and there's a lot of great information and some really good people. They put the BDD website up. There's a lot of good resources on there that I even use with my clients, and a lot of things clients have given me feedback that have been great for them. So definitely know that the IOCDF is your one-stop shop for BDD treatment, for BDD education, not treatment, but to find treatment, but BDD education and body image. Because like, Robin was saying, please don't get your body image and BDD advice from a TikToker or somebody on Twitter. So definitely that. Thank you to everybody in the community that watched today, that put in comments. We're nothing, Chris's Corner is nothing without the viewers and the interaction. So people like Lana, people like Alexandra, everybody that asked questions today, thank you so much. Also shout out to all the people in our BDD community. We saw like Phyllis, and we saw Eric, and we saw Dennis. I love our community. So thank you, everybody. Just like Robin said, fight the good fight. Remind yourself it is always about personal connection. That's the thing you're going to remember throughout your life, is those connections that you made. Don't go anywhere yet, Robin, because I will say a quick goodbye at that. But just a quick couple announcements. So the online conference that's taking place October 8th through the 10th is now, you can register now. It's onlineocdconference.org. Robin and I are doing a talk with a couple of good people like our friend Scott Granite about how to navigate image and BDD in a focus-obsessed world. So if you come out to the conference, there's definitely BDD talks and body image resources there. This weekend, for those of you that speak Spanish or are bilingual, we're having our Spanish OCD conference at the IOCDF. I'm going to have our good friend Jess put it up, but it's Conferencia de Talk. .com. So you can register for that, and this weekend go to the OCD conference. Also, don't forget the 1 Million Steps for OCD walk, which shout out to Dennis because him and his family are the inspiration behind the walk. You can read their incredible story on the IOCDF website. That walk is happening now. The registration is open. So there's 30 walks happening around the country, including the flagship Boston Walk, which will be Saturday, September 18th. So you can register. It's free at iocdf.org/walk. If you didn't get any of your questions asked, definitely please go to iocdf.org/peace of mind. You can submit your questions, and you can also look at the upcoming live streams with Liz and with Tom and with your other advocates like Ethan and Katie. Last, like and subscribe to all of IOCDF's social media, and don't forget to iocdf.org for all of your resources. Thank you so much, everybody, for being out here. Yes, there is a BDD track at the conference. Thank you, Dennis. So if you have BDD, please come out to the October 8th through the 10th conference and get your BDD information there. Finally, I have to say a big thank you to Robin. This would not have been the same without you. Thank you so much for coming out, and thanks for being here and dropping knowledge on everyone. I love you. You know that. Thank you for coming out. It was so good to see you.
Thank you.
All right, take care, everybody. We hope you have a great rest of your day. We hope this helped, and thank you so much, everybody, for coming out and supporting Chris's Corner. Really appreciate it. Thanks again, Robin, to the community, and Jess, who helped us out today from the IOCF. Take care, everybody. Bye.